Hello, everyone. This is Rebecca here again with part two of What is the Wounded Masculine? So, part two is I'm going to explore and answer the question who seeks my treatment and why? And I know have talked about this in other contexts. I'm going to talk about it more in the context of this concept of the wounded masculine. Um, so the people that reach out are, just to review, the symptoms that cause people to seek out my treatment fall into one or more of these categories: chronic erectile dysfunction, premature ejaculation, social sexual shyness and anxiety, inexperience, quote unquote, late bloomers, trauma, PTSD, wounds, body, those are trauma, PTSD, wounds, uh, body image issues, and often this is all accompanied by a deep sense of shame. Um, Specifically, the penis can become the enemy, right? This, of course, for men, when it doesn't quote unquote work. So the man it belongs to experiences fear, shame, and repeated failure, or failed sexual experiences. Internalizing that he'll never be or never measure up, right, to what a real man is, it can really destroy self esteem. And for women, this can be when a woman has experienced some kind of abuse or neglect where she has not had an opportunity to really develop a full sense of self before being wounded. And so this impairs her ability, right, to be able to engage in healthy sexual relationships or intimate relationships. It can also mean somebody who is incredibly shy, a woman. This could be a man too. Um, and so so that there's this avoidance, right, that comes up. So it's men and women. So coming back to men, what do, well, it could be men and women, but I wrote this, I think, because the majority of the people who seek my treatment are men. However, human beings, we all struggle with these, we all struggle with these things. So what does a man do, I'll say, when experiencing all of this? So often she avoids being intimate. So inhabiting our bodies with ease is fundamental to having enjoyable, intimate experiences. And if it often means to be willing to be vulnerable and receptive to experiencing the grief, loss, anger, and pain that is lodged within the muscular and cellular structures of our bodies. So patients that I see engaging in my intimacy behavioral therapy program often experience a kind of, through the process, a kind of inner softening or thawing out of a healing process that enables them to experience more joy when feeling into their body sensations. In many, this creates an ability to trust their internal physical experience, which in turn allows them to develop intimate connections. So, my primary fundamental belief in all of this is that it is impossible to create genuine, intimate experiences with other human beings until we have established that kind of intimate uh, ease and sense of self within our own bodies, right? So, a grounding, a sense of ownership, a sense of being able to feel into our sensations. This is crucial. It is impossible, in my view, to be able to develop what the ability to be able to be vulnerable and trusting and seen and witnessed by another person, which is how we experience intimate relationships, until we've established that within ourselves. So I think that is like the most important point. And so yeah, so I hope that you've enjoyed this, and it gives you something to think about, and maybe it reflects some of your experience, or maybe it doesn't. But I felt like it's really important to put my perspective up out there at this point, after having shared, so many videos about my work. So until we meet again, um, please enjoy and take good care of yourselves. Thank you for listening.